Hi, this is the lab presentation for Vital Signs. This is nursing lab number 2. Learning outcomes for this lab will be taking vital signs essentially, and you will need to know your normal ranges. You will be actually taking vital signs, temperature, pulse, respirations, etc. You will be learning the different methods for each vital sign and why you use what you use, and also will be identifying pulses, those that you've learned before, and will also be identifying breath sounds. Now remember, our labs are based on information that you've already learned in A&P, for example, chest anatomy and pulses. So I'm not going to go into detail about these. You can refer back to your A&P books, but we're assuming that you have this information and we're going forward with this as far as our nursing classes are concerned. So, vital signs themselves, what's the most important thing? They are probably one of the most important assessments that you're ever going to do. And they're not just the act of let's take a temperature, blood pressure. It's why do you take these? What do they mean to you? They are affected by physical, environmental, or psychological stressors. Any sudden changes have meaning, and if there's any difference in the baseline versus the present vital signs, you need to assess further. In other words, you need to establish a baseline. You have a new patient, you need to take a full set of vital signs to say where are they at this moment in time. And then what you do as an RN is you identify the trends and you compare them to your baseline. And where this is around Valentine's Day, I thought I'd just put in a few fun facts for you. States of the heart: the average heart pumps about 60 to 100 mils per heartbeat. That's not too bad. An average heart pumps about 5 liters per minute. And as you can see, we've got 5 liters down there of Canada Dry. That's how much fluid is going through your heart per minute. It's pretty amazing. Your heart pumps about 1,900 gallons per day, or about 48 million gallons by the time you're 70 years old. That's not bad for a 10-ounce pump. On page 318 in your text is this chart, and it's the normal vital sign ranges, which you can review on your own time, and those are you're going to have to commit to memory, because those will be with you for the rest of your career. This chart here is a chart where we'll identify the pulses: temporal, carotid, brachial, radial, femoral, popliteal, dorsal pedis, and posterior tibial. So those are the pulses that we will be finding on each other in lab. And one of the pulses that I feel is very, very important is the apical pulse. And how do you find the apical pulse? Where is it? We need to find what we call the point of maximal impulse, and that is the apical impulse. It's the apex of the heart, and that's where you can hear the apical pulse most readily. And let's see, it is the first place where you put your stethoscope to find that. So you need to find what we call the PMI. You need to know your landmarks, and again, this goes back to A&P. Where's the sternum, manubrium, etc. You'll probably want to take a peek at these and make sure that you can identify those. And here is a chart identifying the point of maximal impulse. And as you can see, it is the 5th intercostal space, and it's the mid-clavicular line. So what you need to do is identify the clavicle, and the mid-clavicular line is this, excuse me, and then you come right straight down, and your 5th intercostal space, if we count the spaces 1, 2, 3, 4, 5, that's where you'll probably hear the apical pulse at the best through your stethoscope. Now this happy gentleman has a figure of a chest anatomy on superimposed on his chest, and you can see where his heart is and where you can find the apical pulse on him. So it just gives you an idea of looking at a chest where it might be, and usually it's very close to where the nipple line is, near the nipple. If you don't hear it well, you can lay your client on the left side or have them lean forward in the chair. Women, for example, may have a fair amount of breast tissue. You may have to actually lift the breast and place your stethoscope, or you can try the 2nd and 3rd. ICS means intercostal space as an alternative. Once you locate the pulse, just hang around there for a while and listen to it. Focus on the rhythm. What does it sound like? Is it regular, irregular? And count it for 60 seconds and try to ignore other sounds such as breath sounds and vowel sounds, and you can get your rate that way. If you have a hard time finding other peripheral pulses, this is not for your apical pulse, but if you find other peripheral pulses, you can use a device that we call a Doppler. And on the lower left-hand side of your screen, you can see that the handheld Doppler, and you can see the device itself and the wand that the person is using on the dorsal pedis pulse of this person's foot. Now, you know where approximately the dorsal pedis pulse would be, so that's where you would put the gel. The gel is a conducting agent, so you need to have plenty of gel down there, and it conducts the sound. You hold the wand at about a 45-degree angle, and then you kind of move it around to find the best quality pulse, and then you can count it. You also need to describe it. If it's strong, weak, bounding. Wouldn't be bounding, or you wouldn't be using a Doppler, that's for sure. So this can be used on radial pulses, posterior tibial pulses, popliteal, whatever needs be. Now, at this point, I just want to spend a little time on stethoscopes, what I call stethoscopes 101. If you don't have a stethoscope, please don't go run right out and buy one. Figure out what works best for you and come to lab first. We have some that you can sign out as along with blood pressure cuffs also. So you'll at least get to practice with them, see what works best for you. A good stethoscope with only a diaphragm will work. In this picture that I have here, this actually it's a double chest piece. It has a bell on the top, which is indicated by the arrow, and a diaphragm. And if you get a stethoscope with only the diaphragm, it works perfectly well for brow sounds and lung sounds, and that's essentially what you'll be doing, listening the most for. You also see on the upper right the earpieces. There's two earpieces, and when you put these in your ear, always place them pointing forward, and it makes a good seal. If you put them in your ears facing backwards, they're uncomfortable and you won't hear well. So just to let you know. And if you do have a double diaphragm chest piece here, you have to turn it to the one side or the other in order to be able to listen. So you'll probably find that out when you start practicing with them. Lung sounds, using your stethoscope, you can see on the lower left-hand side, the person taking the lung sounds, doing the lung sounds there, is holding a stethoscope between their first and second finger. This is a double chest piece, and the person is holding that, and their thumb is actually underneath the tubing. That's so you don't hear any what we call adventitious sounds of the tubing rubbing up against the skin, clothing, or that sort of thing. So that's a good way to hold it. As far as your breath sounds are concerned, always listen side to side. You need to compare, and you need to get into a routine of comparing one side to the other. Start at the top and work down, start in the front, and then go to the back. Now, one of the ideas you might do is, and I really would like you to do, is listen to your peers, listen to your family, to try to identify different sounds. I want you to begin to understand and identify what normal breath sounds are. But then, if you find somebody's got a bad cold, they might be wheezing, they might have some junk in there, that you might even you might hear some rhonchi. So I want you to get to know your norms, and then see if you can find anybody that you can identify some abnormals on. Plus, we do have a site on Blackboard that you can actually go and listen to different sounds. Another measurement for vital signs is pulse oximetry, and pulse oximetry is an indirect estimate of the oxygen saturation in your blood. That sounds like a mouthful, but what we're doing is we're trying to estimate the amount of oxygen in your blood. Is this person oxygenating well? There's a device you can see is in the lower right hand corner. You put it on a finger or a nose, bridge of a nose, earlobes, but most of the time you can be using the finger. Make sure there's no nail polish. And you can also see that there's a pulse on there too. The radial pulse should correlate with the pulse. So if you've taken your vital signs, you've taken a radial pulse, if you pop on this pulse oximeter, the pulses should be about the same. And if they are, then you know you're going to be getting a good pulse oximetry reading. The normal is 95 to 100. That's your normal value. Anything below that, you need to talk with your instructor because further assessment is needed. That brings us to the end of the presentation for Lab 2. You have more items to complete on the blackboard, and if you have any questions on this lab presentation, please send them to me or bring them to the lab, and I'll be more than happy to answer them. I also will be putting up a student version of this PowerPoint so you can download it if you wish. Thank you.